present the challenges and the way forward for the preventive and promotive healthcare. So at the outset, I would be covering with a small introduction and the emphasis given for preventive and promotive health in the National Health Policy 2017, as well as the role of Siddha system of medicine and especially the role of each Siddha physician, and as well as the way forward. So this quote is just not taken from any ordinary book. It's given by the technology think tank of the Ministry of Science and Technology, Government of India. In 2000 BC, they said, eat this root. And in 1000 AD, they said that root is heathen, that it's an uncivilized practice. Say this prayer. And in 1865 AD, they said that prayer is superstition. Drink this potion. Potion is nothing but decoction. And in 1935 AD, they said that potion is bad. Swallow this pill. And in 1975 AD, they said that pill is ineffective. Take this antibiotic. And now, in 2000 AD, they are now saying that the antibiotic is poison. We are back to square one. Eat this root. This is our ancient wisdom that we can boast of, and our rich traditional knowledge that is handy to tackle any given health condition. So I would like to here highlight that on day one, Dr. Sivaran sir pointed out of the Ther and Kudineer. So many valuable herbal decoctions we have to tackle various health issues. But there are special decoctions for Vari Kudineer, Vadasura Kudineer, Pittasura Kudineer, Ayyasura Kudineer, or Tondasura Kudineer. Actually, we have many more decoctions. We can take this as a valuable piece of information, and we can give this as a first-hand treatment based on the classification of the patients that we do by our Udaliyal assessment or by Yaka Ilakanam assessment. So this basic work we have failed to do. The Siddhas have categorized easily the group of patients or the personalized tailor-made medicines that we have enough, and we can easily tackle the disease by utilizing these decoctions. So our decoctions are still effective, and the earlier speaker, what you heard from Dr. Balamurugan, he has nothing more than a variety of decoctions in his clinic. There are no heavy metal preparations such like that in his clinic, but what he prescribes is most of the decoctions from this Ther and Kudineer only. And now the era of which we are is the era of antimicrobial resistance. Such is the volume of antibiotics we come across in the private practice by the allopathic physicians, and now there's a whole lot we have to treat. This is antimicrobial resistance. So for this we have handy remedies. So veru paadu thalai paru mijjina kaal mella mella parpan chenduram pare. So even if you take a route for research, beware of its availability. So our research should be sustainable. If you take a root bark for research, it won't be sustainable. If it is a rare or endangered species, better not to take it for research. So these are the few things you have to keep in mind before going for research. So we are not the only country which we are proud of. There are 170 member states or countries that are using traditional remedies. So the WHO has already given guiding principles for health promotion. So I would be, I am in a position to consolidate all the previous speakers' points. So first is the empowering the communities to overpower the personal and socio-economic environmental factors, right from Dr. Sivaraman to Dr. Tangavel, who has been stressing about the socio-economic factors. In India, we are going worse. We are going worse in the hunger index. We have to overcome this. So if you want to do it, if you have to provide good food, I've gone to many rural health camps in northern India where people even don't have a one-time proper meal. So that is the actual picture of India, where the socio-economic status is very poor. And the hunger index, we are going from worse to worse. So these are all the things we have to keep in mind and empower for health promotion. And we have to involve the family. And even Dr. Syed Isar and Dr. Balamurugan stress the importance of family-centered medicine. And our Saint Tirumular, Siddha Tirumular, have propounded the perfect example for holistic health in his poem Marupadu Udal Noi Marudana Lagum. So we all know this, but we are not implementing this. So we have everything with us, but we are failing in our implementation part. And again, Dr. Tangavel sir stressed about this equity and social justice, and whatever we do, it should be sustainable. And this is one document which we can boast upon, that we have a Siddha document published by the WHO. The WHO International Standard Terminologies on Siddha has already been published, and it is available in the website. So you can go to this link, or you can Google it and get it. And it is for the time-tested healthcare practices. So we have time-tested healthcare practices. For example, if you take any uterine tonic that is available in the market, or any liver tonic, or any tonic for kidney renal stones, you have our drugs inbuilt in that. You have many drugs which are being across by the allopathic physicians across. We have time-tested remedies. And we have to effectively communicate. That was the point stressed out by Dr. Balamurugan also. So for this communication to happen, these documents have been published. And another one document, this International Classification of Diseases, Traditional Medicine Module 2, this also has been published by the WHO, where the Traditional Medicine Module 1 comprises of traditional Chinese medicine, the Korean and Japanese medicine, whereas the Traditional Medicine Chapter 2, it comprises of our Ayurveda, Siddha and Unani systems of medicine. And we are also in the pipeline for developing this WHO benchmark documents. The title of this conference is very well said in the National Health Policy of the Government of India, which was introduced in the year 2017. So the aim of the National Health Policy itself states the prevention of disease and promotion of good health. So the key policy principles include patient-centered and quality of care. Whenever we move to patient-centered approach, we succeed. So always have this in mind to be patient-centric and improve the quality of care we give. All these points I have taken from the National Health Policy. It's not my own points. So the National Health Policy, the sub-themes of this conference, everything are already we are mentioned in our Siddha system. For example, the second point, balance healthy diet and regular exercises, which we don't advise to our patients. For example, whenever a diabetic patient walks into our clinic, first we have to advise the diet the patient he has to or she has to take. So the first most point we have to stress upon is the diet that patient has to be prescribed, or how best we can help him to take a better diet, and the regular exercise. The third only comes about any drug. For a given diabetic patient, this first things, if you teach the patient about the diet and exercise, automatically his glycemic control will be achieved at a very sustainable level. And the another one thing we often fail to address is addressing tobacco, alcohol and substance abuse. So we have a very responsible role to play as a family physician. If they just say, I'm a smoker or I'm an alcoholic, we just ignore and prescribe medicine. No. We have to counsel them, and we have to teach them the ill effects or how it can impact their life or quality of life. So we have to address this. And these are also the programs which are mentioned in the National Health Policy, where we have a lot of role to play, especially in the vector-borne disease control for chikungunya, dengue epidemics, and we have a lot of role to play, especially in the multi-drug resistant tuberculosis, which plays a major role. And we also have played a major role during the 2000 pandemic of HIV AIDS, and also we have a lot of role to play in non-communicable diseases as well as in mental health. The mental health problem, it doesn't only affect the patients. The entire family is affected. If a patient is affected or his mental health is affected, the entire family is affected. So we have to give importance for the family. And already I've stressed upon this point. So we have to develop a protocol for mainstreaming Ayush as an integrated medical care. We cannot go alone as a medicine. We have to integrate. So we have a huge potential for effective prevention and therapy that is safe and cost effective. So Dr. Thangavel in the morning, he mentioned about the reductive approach of the biomedicine, and this was acknowledged by Dr. B.M. Hegde, a renowned cardiologist. So he says that the flaw of today's approach to treatment is that the human body is seen as a car machine which can be repaired part by part, whereas the human body is a whole entity and should be treated in entirety. How else can one explain the side effect of drugs used to treat one organ affecting the other organs? I'm not undermining the potential of allopathic medicine or biomedicine, but I'm just inferring his views. And again he continues to say that the pharmaceutical industry does not create cures, it creates customers. So that was also Dr. Balamurugan's point with respect to organic foods. It creates customers. So as you all know, Siddha is a comprehensive treatment. So we cannot separate anything from here. lifestyle advice plays a valuable role as well as the diagnosis. So his point is, if you properly diagnose, 90% of the work is done. So diagnosis plays a very major role, and in that you can play a very major part. Apart from the diet regimen, the internal therapies and the external added therapies for wellness, etc. So I appeal to each one of you to be a Siddha family physician. You have many roles to play, and you can, each one of you can be a family Siddha physician. So you need to give time. You need time to give us a counselor for the patient, especially for the diagnosis, for his dietary habits, lifestyle abuse, advice, and sleep pattern also we have to advise. For example, interleukin-2 is released when there's a proper sleep and it has anti-cancer activity. We have to advise pertaining to seasonal regimen, in which season the patient gets sick, and what diet he has to take or what lifestyle alternatives he can make. And nowadays you get patients with a lot of phobias. Every test or every imaging diagnosis what he gets is normal. But sir, I have a fear about this. You get many patients nowadays just because of fear or anxiety. There will be nothing apparently clinical. But you have to take time. We cannot brush aside that patient. You take time to counsel that patient and you can succeed. So this is the very good black box randomized control trial model. So Dr. Syed Disar yesterday, he is also one of the authors, published in the year 2013. So this protocol was given the excellence in integrative medicine by the European Society of Integrative Medicine and recommended as a blueprint for future clinical studies. So that's what I'm trying to say, that whether it be your practice or your research, we have to be accommodative in including the comprehensive treatment protocol of our Siddha system of medicine. We cannot go alone. We have to include our Siddha as a comprehensive treatment protocol. So this was the treatment protocol which they had for this study. So they included all of these treatments, 15 appointments based only on Ayurvedic diagnosis, tailored from the following treatment modules. See how we can tailor-made treatments. And they had a comparator group which had the conventional treatment. So again 15 appointments based on the conventional diagnosis composed of the following treatment modules. So likewise, we have to plan our research, and also the methodology depends upon our research question. So our research question, what is the patient's experience of taking Ayush? We can do it with a qualitative research. Are there any side effects from Ayush? We can do an observational study, a longitudinal study, or a case control study. And which conditions seem to respond well to Ayush? We can get it done by using patient registries, observational study, or a cross-sectional survey of practitioners. What is the efficacy of Ayush for a specific disease or condition? We can do a placebo-controlled trial, or a double-blind control trial, or a randomized control trial. And what is the effectiveness of Ayush in real practice? We can do a pragmatic or a practical randomized trials with parameters for effectiveness. And what is the economic cost of Ayush for treating a disease? And we can go with health economic evaluation. So this protocol we can implement, so we can have the conventional inclusion and exclusion criteria. For example, have planned the study for osteoarthritis of knee joint. After we include this patient, then we can further randomize to two groups based on our Siddha constitution diagnosis. We can first group, we can group it using a Vali Prakriti or a Valal Adal Prakriti, and we can subject them to two groups where we can give a drug and we can give a placebo or a standard control group, or we can, based on our Siddha constitution diagnosis, we can group them as Ayya Prakriti and Ayya Adal Prakriti, and we can do a study with another drug, a comparator drug, and we can give another placebo or a standard control trial. So another model also we can do it. We can have an inclusion and exclusion criteria using the conventional model, osteoarthritis of knee joint. Then we randomize the patients based on Ayush diagnosis and a standard control. And further, we can subgroup the Ayush group into two groups as Vali Prakriti group and Ayya Prakriti group. So we can customize, incorporating our Siddha constitution analysis. So coming to the scope of traditional medicine, India is the largest populated country, and combined together of 6 countries, our population is growing, and we are the leading in the population. At the same time, India is bearing the dual burden of diseases, where one end, on the lower end, we have the malnutrition, hygiene, immunization, sanitation, and infectious diseases are the major concerns. On the higher end, we have environmental health and lifestyle diseases. So India is facing the triple burden of diseases. In other words, we can say that, where we have the unfinished agenda of communicable diseases, and we have the non-communicable diseases, namely the 4 diseases, that is heart disease, cancer, diabetes, and chronic pulmonary diseases contribute nearly 80% of the deaths. See, these figures are alarming. If you can tackle these 4 diseases effectively, you can handle it better as a family Siddha physician. So these diseases share 4 common risk factors. As I already mentioned, you can counsel the patient to refrain from tobacco use, harmful use of alcohol, and you can advise them about how they can take a healthy diet and how they can modify their physical activities. And all of you are aware of the COVID-19 and the emerging infectious diseases. So this is just one point. Reduction of 5 mm Hg in the systolic blood pressure can reduce 7% reduction in all-cause mortality. So this is the level or role one can play. So you might find how I can play a role as a Siddha physician. Just 5 mm of reduction in systolic blood pressure, you can reduce the all-cause mortality of 7%. And after COVID, everything has become topsy-turvy. So health promotion was given more priority. For example, the physical activity came to a halt. So we are all confined to our quarantine, and we have changed our work pattern from work from home. We have started to overeat and less healthy diets, and because we have more food delivery options, and most importantly, our stress levels went up. And see, this is the reason why the poor recovery and outcomes of COVID-19 patients with pre-existing chronic conditions and associated health risks. See, there was a study done in Singapore where the overweight COVID patients required 6.3%, they required more supplemental oxygen, and 1.2 times they required more mechanical ventilations. In other countries, the scenario was different, and the other developed nations, 76% of the patients who died from COVID-19 had high hypertension or high blood pressure. See, when you have comorbidities, the condition worsens. So we should be a family-centered physician so that we can control these risk factors. So the take-home message is your devotion and care can bring healing, comfort, and hope to the patients. So if you are a family physician, you can give that care what is needed to the patients. Coming to the role of Siddha physicians, we have a five-fold role to play. So Dr. Balamurugan dealt with a proactive role, how we can prevent illness, and we are hearing about the promotive health promotion for the last 2 days. We know about the curative, and we have also a role to play as a palliative health care, which improves the quality of life of patients, as well as we can have a part to play in the rehabilitative services. So just not the 5 disabilities, there are a list of disabilities where Siddha can play a part. So as you all know, our first point is the prime importance is to treat the underlying cause, which is subtle. So as many imaging techniques or many markers are on the rise, but the diagnosis is very elusive to the doctor as well as to the patients. That kind of category of patients we often come to our clinic or our OPDs. So based on our theory, Vadiyadal IM, we can easily diagnose the patient and we can effectively treat them. So this is the ICD-11 category, where there's a list of conditions where they have given as idiopathic. Cause is not known for even idiopathic rhinitis, but we have our penism is grouped into 9, and we can effectively handle. So that's why I'm saying that the cause is not known, but based on our Siddha diagnosis, we can identify the cause, root cause, and we can deal the disease effectively. So Nadi plays a vital role, and I urge all of the students to learn this technique. So it may be elusive at the initial stage of practice, but as you go, your picture, your understanding of Nadi improves daily on a daily basis. So again, our Neikuri, we often fail to document. So we all know, we all talk about artificial intelligence and machine learning, but how far we have documented in our regular OPDs at the institution levels or in our private practice. So do we have a regular backup of data of our Nadi or Neikuri for our patients? So Neikuri, it's not only used, Nadi is not only used for diagnosis, it is used for prognosis of the patients. So in our text, you would have heard of Erimandu. There would be just one indication, Iduppu Vali Theerum. So here is a study which was done by Ramp et al. In the year 2009. So in the blister group, they applied this cantharidin blister. The pain score continuously improved from 7.2 at baseline to 2.9 at day 7. where the score remained unchanged in control patients, that is waiting list control patients. So the use of analgesics was slightly higher in the control groups and no serious adverse effects was observed. So just a small piece of information in our text which has been practiced in the Western traditional medicine. And with a cantharian blister, they also treated a case of pleuropneumonia and thoracic pain syndrome. The earlier speakers also, they talked about these P4 medicines, and nowadays we are in the age of P5 medicines, where precision medicine is an evolving field trying to provide a categorization of diseases into subgroups based on genomic information. So this is the team work from CCRS developed by Dr. Kannan and his team. So Yaka Yelagnam assessment of body constitution. And coming to integrative medicine, so Rizorin is in a fixed dose combination of rifampicin, isoniazid and piperine, resulting in a decrease of rifampicin dose from 450 milligram to 200 milligram. So you see the reduction in dose that 10 milligram of piperine can make, and also that 60% improvement in its bioavailability. That's the role of integrative medicine. So nowadays we ask the patients to of mindful eating and to use the 5 senses, and the sight, smell and touch induces cephalic phase of insulin, and they reduce the postprandial sugar level. In some cases, you would have noticed that the postprandial sugar does not come to normal. But when we advise the patient to use their hands to eat, it helps in reduction of postprandial sugar levels. We all know this formula, and we also know that whenever we give sweet taste, our IM humor increases. See, here was a study that sweet receptor is activated by amino acids secreted by specific bacteria. It blocks the release of antimicrobial proteins. See how our unique ancient wisdom still stands true, whereas bitter receptor releases the antimicrobial proteins. See, our ancient wisdom still stands tall. And everybody knows about this gut-lung axis, which played a major role during COVID-19. And our Siddhas have stressed beyond doubt about the gut health or gut dysbiosis for healthy well-being. So, and coming to mind-body medicine, the dynamic centers which function as nerve plexus, we would have studied this in the first year, Thotrakaram Arachi, and forgotten. But the Western world celebrates this as mind-body medicine. And this is a very good tool, and all the wellness centers across the world use these techniques and to treat the psychosomatic diseases. So right living begins with right thinking. This is the routine line of treatment which we know, and the special therapies. So the chapter you are learning today is going to save one's life tomorrow. So dear students, kindly pay attention. The way forward. So before going to the way forward, I just want to highlight the differences between the research phases in drug trials and Ayush, where we start from screening of chemical substances go to the biological mechanisms, and we come from phase 1 trials, phase 2 trials, phase 3 trials, and then clinical practice. Whereas on the right side, we start from clinical practice, and Dr. Sivaram sir also spoke about the reverse pharmacology approach. So basically, there are few differences in conventional medicine and Ayush, where evaluation occurs before wide availability, and whereas in Siddha, evaluation is available only if frequently used. Standards are often available in the conventional medicine, but it is individualized or personalized or tailor-made in our Siddha system of medicine. In conventional medicine, there's a good academic research structure, but compared to the previous era, now we have developing the academic research structure. And there is a huge and enormous funding in conventional medicine, whereas we have a limited funding in Ayush. But yesterday, I was glad to note from Professor Dr. Jagannathan about the funding opportunities available through NCISM. And as in conventional medicine, research motivation is improvement, whereas research motivation is justification. So when in research, we have to know about type 1 errors and type 2 errors. So type 1 error is false positive and type 2 error is false negative. This may look funny, but we have to be cautious in doing research. So for example, if you diagnose a false positive for a COVID patient, that can erroneously label a person infected, which consequences including unnecessary quarantine and contact tracing, which is better or which is minimally better than a false negative results, which are more consequential because infected patients who might be asymptomatic and may not be isolated and can infect others. So this again goes to sensitivity and specificity when we evaluate drug diagnostic test, and sensitivity refers to test ability to designate an individual with the disease as positive. So a highly sensitive test means that there are few false negative results and thus fewer cases of disease are missed. So specificity of the test is its ability to designate an individual who does not have a disease as negative. So a highly specific test means that there are few false positive results. So whenever we use NADI as well as other tests, we have to be certainly sure. So this evidence-based medicine was also pointed out by Dr. Siddha, and where we have on the top the clinical practice guidelines followed by the meta-analysis and systemic reviews starting from the animal and laboratory studies. We have now the good clinical practice guidelines in the year 2013, where we have good clinical practice guidelines for Ayurveda, Siddha and Unani system of medicine, which is mandatory for us to follow. So the way forward is already stressed by all the previous speakers to convert the experience-based medicine to evidence-based medicine. And not that we have to publish the same in peer-reviewed international journals. It might be a painstaking effort. If you publish a literature review, that would be, say for example, I had a review from Journal of Ethnopharmacology. The review contained the reviewers from 3 reviewers running to 3 pages. And it took me months to correct that review, and it got published in the Journal of Ethnopharmacology. So it may take time to just publish a review paper alone, but don't stop and be positive, and you have to have a perseverance to publish that. And Ayush streams to be geared to tackle primary health care needs of acute conditions of the populations. gone are the days that we treat just only chronic diseases. We should be a family physician available for the patients to advise them from simple maladies such as fever, cold, flu, headache, diarrhea, pain syndromes. So we should be geared up to treat the primary healthcare needs of the patient. So again, I stress that integrative medicine is the need of the hour, and this was the topic of Dr. G. Sivaraman. So the paradigm shift is needed to realize the potential of Ayush streams, especially our Siddha medicine. So we have to translate our research outcomes from bench to bedside for the benefit of public. So we have to start early. So if diagnosis of disease are achieved at a very early stage, it will be vital to achieve fruitful therapeutic outcomes. So we have to accumulate data. Let us determine to collect udaliyal information to all our patients, either it be our clinic, Dega Elakkanam. Let us start collecting Dega Elakkanam to all our patients visiting our OPD or our peripheral institutes or any institute. So let us start collecting data which will be available for future research or this machine learning or artificial intelligence. We are speaking this for a very long time, but we are yet to start collecting data. So preclinical studies to study the mechanism of action is also needed, and we also need to have the quality of raw material and to follow the good agricultural and cultivation practices. And one point is we have to identify substitute for unavailable ingredients or endangered species. So educational modules, so the NCSM is taking proactive steps which gives hands-on training to the budding doctors. So personalized medicine, again gene sequencing we can do through next generation sequencing, and we need specialists from the biochemistry domain, and thanks to Dr. Gayatri Gunalan. So they should be taking the lead from here, and also the pharmacoinformatics, the docking studies which we can do at our desktops, and Siddha Genomics is there for precision medicine. So this is not my domain, but it's a technology for determining the sequence of DNA or RNA to study genetic variation associated with diseases or other biological phenomena. So it enables the integration of hundreds to thousands of genes at one time in multiple samples, as well as discovery and analysis of different types of genomic features in a single sequencing run. So it can help in cancer research, hemato-oncology research, and reproductive health research. So our Siddha genomics, our body constitution, and our lifestyle regime, it's being stressed upon again and again for personalized medicine. So the Ayurveda flight has already taken off. Our Joint Secretary, Madam, has already pointed out, and we have to at least follow them in suit to do this project, that is Siddha Genomics project. So another one very broad area of research, nutri-epigenetics, the study of food nutrients and their effects on human health through epigenetic modifications. So this focuses on the process by which nutrition regulates how one specific gene is turned on or off. So we have Siddha principles that food is medicine and medicine is food. And we have specific foods, very pacifying foods or adult pacifying foods and IF pacifying foods, which we have to advise patients on a daily basis on a clinical practice. So again, the role of pharmacoinformatics and the absorption, distribution, metabolism, and excretion predictions also we can make in our desktops. And the way forward is whole is greater than sum of its parts, and different strokes for different folks. So we have to target personalized and tailor-made inventions for individuals and communities, and we can provide seamless integration of wide range of physical and digital platforms, health anywhere, anytime. So coming to the concluding slide, diagnosis is the key, and one size fits approach should be used with caution, as in the case of COVID. And Siddha medicine is a unique blend of holistic care, offering advice for a more natural, healthy lifestyle. So I appeal to the students to equip you and treat the patients with empathy as you treat one of your family members, and be a successful and effective practitioner. Before concluding, I would like to narrate one story. So there was an ancient Siddha or a Jnani, and whatever question you ask him, he would answer. And one young lad, he wanted to upset that the Jnani or the senior person. So he devised a plan, and what he planned was, I will take a small sparrow in my hand. I will ask that Jnani whether this sparrow is alive. If the Jnani says that the sparrow is alive, he thought of, I will squeeze the bird in my hand and show that it's dead. And the young lad planned, if he said it is alive, if it is dead, we can let the bird fly. And he went to the Jnani and asked and posed the same question. And the Jnani replied that the sparrow being alive and being dead is in your hands. That's the take-home message I want to give. So the future of Siddha medicine is in your hands, young generation. Gear up. Thank you, one and all.